Hi, this is Dr. C. Today we're going to be a little more serious. We're going to talk about something that is very imminent, on the scene right now, very much in the news. So, we're going to talk about the coronavirus. A lot of misinformation out there. I want people to know what the real story is, what we know, what we don't know. You never know, even tomorrow it could change. Let's start right with the basics. First, I want to introduce Dr. Jane Lochrie. Jane is an internal medicine doctor who very recently retired. She ran the residency program over at St. Vincent for 24, 25 years. She now is running the St. Anne's free medical program that I ran for a long time. So we've collaborated for many years together. So welcome.
Thank you.
So let's talk a little bit about viruses. What the hell are they? You know, you got to know what you're dealing with, first of all. What is a virus? It's just a little tiny microparticle, but it has its own DNA or RNA. There are 4 different styles. You can have the double helix DNA, just like we have. You can have a single, you can have a double RNA, you can have a single RNA. It's amazing what some of these viruses have. There's thousands of different viruses. For example, very recently we had several coronaviruses that were almost epidemic, almost. SARS, for example, that was back in 2003. We had the big SARS epidemic. It was a little more virulent. It did kill a little more than the COVID does. And it's still out there, but it's better controlled. We also had a recent one too, the MERS. That was back in 17, 18. The MERS virus, Middle East virus. That's why MERS, Middle East respiratory virus. And now we have another coronavirus. We have the COVID-19. What does that stand for? Coronavirus disease in 2019. That's what it stands for. Very simple. So a lot of the virologists and all are very simple people, you know, and they come up with these names. So that's what it is. So a little bit about the viruses, though. They mutate very frequently. Now, there may only be a minor mutation. There may be a major mutation. For example, it probably was a mutation that caused the particular COVID-19 to finally infect humans. They believe that back in Hunan, China, they believe that it probably started at a fish market. I don't know why they call it a fish market. They probably do sell some fish, but it's also, they sell a lot of wild animals as well. So who knows what the origin was, but something mutated and it passed to the human. And now we have evidence for human-human transfer as well. So that happens because of this viral mutation. So, hadn't been that long. It was only recognized in December of 2019. Has not been that long when you look at it in perspective. And in the United States, we didn't see the first case till mid-January, January 21st. Very first case in the United States. Has not been that long. And so, we do have some information. Some. And so, that's why I invited Jane here, so she can answer a lot of our questions for us. So Jane, I don't know if you've encountered anybody who had suspicion for the COVID-19 virus yet, but why don't you tell us a little bit about some of the symptoms that you might see with COVID-19?
About 90% of people have a fever, and a fever is defined as a temperature over 100.4. About 80% will have a cough, and it usually starts as a dry cough and may become more productive, more sputum later on. Many have shortness of breath, and we'll talk about that a little bit later on. About 4% have a runny nose, and oftentimes that's how it starts. It's thought that maybe if people with a runny nose may be co-infected, also have an infection with the common cold or maybe the flu. About 1% of patients don't have any symptoms at all, and those are the patients that you worry about because they're the ones who are walking around spreading the virus in the workplace, in their home. 80% of the patients have a very mild disease. They don't really need anything other than to isolate themselves. About between 15 and 20% have a more serious infection. They'll become short of breath. Those are the people who want to seek medical advice. Symptoms usually start 2 to 14 days after the patient is exposed. So most have start between 5 and 7 days.
Good. And some people get very worried about recognizing whether this may be just a common cold or the flu or anything worse. Because now we're recognizing people who have never been exposed to people who, for example, took a trip to Italy or took a trip to China or whatever, which was the original thought. But now we're seeing people who never got exposed to people who have been that way. And that means it's all over the world. It's in the United States. It could happen, and we could get a cluster anywhere, just like they have in Seattle now. You look at the number of people now who have been infected in the United States, and so far now we've had 12 deaths in the United States. 10 of them are in that Seattle area, unfortunately, right in that one nursing home. And so that's why the evidence seems to be skewed, as far as deaths go, skewed towards the elderly. It doesn't seem to be hitting the kids. Seems to be hitting the elderly. Raising the question of, well, should we be closing schools? Should we be? No, I don't know about that. We don't have all the evidence yet. Right now, and my biggest purpose here today is to talk to the elderly because they seem to be right up there on the risk level. And nobody in Shrewsbury is addressing the elderly with this danger, basically. Nobody. And so that's why we're here. That's why we're here. So at any rate, why don't we go from there? I was interested to see that how they categorize some of these things. There are some people who like to put a mathematical number to everything. They call that the R-nought. Big R, 0, R-nought. But what it does, it tells you how many people, one person who has the disease, how many people will they, on an average, infect. So it tells you a little bit about the virulence of the disease, too. Measles would be anywhere between 12 to 18. One person can infect 12 to 18 people, on an average. Very virulent. What else? How about the flu? 1%. How about the COVID? Seems to be about 1.5 to 2.6, right in that range. So it's not terribly virulent. That's why you heard 80% are having very mild symptoms. They don't have to be hospitalized. They do, however, have to be quarantined, but nevertheless, very mild symptoms. So I don't think that we've encountered anybody yet in Worcester County, so we've been pretty safe so far. And I know that no school closures, but let's talk a little bit more about the viruses. The person-to-person contact so far in the United States. What is your perspective on the person-to-person contact? Who's been getting it, basically, in the United States?
It's, like you said, the elderly are getting hit the hardest. So if somebody comes into the grocery store and stands next to you, how likely are you to develop the disease? And the answer is it depends. It depends on how close you are to the person. And the recommendation from the CDC used to be stay away from somebody who's ill by 3 feet. Now they're making it 6 feet. And the next is how long the contact is with them. So if you're just standing next to the apples and reached over and the person had COVID, very unlikely that you were going to develop it. But if this was an old friend of yours and they, you sit, talk to them for 10, 20 minutes, then you're more likely to get it. Probably the most important thing is whether the person sneezed or coughed on you. That's where the virus is. It's in those little droplets that come out. And the last thing is how often you touch your face, your mouth, your nose, and I know you have some thoughts on that. So
I was surprised that we supposedly touch parts of our face 23 times an hour. Mm-hmm. I couldn't believe that until I started doing it myself, and I didn't count the number I did in an hour. If I was really obsessive compulsive, I would have done that. But if you have not sterilized your hands between the time you last did it and then you touch, it is a possibility. Remember, it's in the communities now. It's not just person to person. There's community spread as well. So you do have to always protect yourself. How can you stop touching yourself if you could wear a mask? Mm-hmm. That's probably the one good thing about a mask is that it's a deterrent for people to go and touch their face, really. And otherwise, it doesn't do a heck of a lot. It's not going to prevent you from getting the disease from the air droplets if you got hacked on. Let's face it. It's not going to prevent that. But, and you should leave the N95 mask. Basically, it's a mask that should be worn only by someone who has the disease and tested for it, positive, or healthcare professionals, or if you're caring for somebody who has known disease. Mm-hmm. So you may not be a healthcare professional, but if you have somebody who's positive, tests positive, then you should wear a mask. Why don't we talk a little bit about this self-isolation, this self-quarantine? Mm-hmm. You and I grew up when there were sanitaria around for TB, and that was the big thing, is just quarantine them. Mm-hmm. Even before we were born, they had leper colonies. They shipped them out to an island somewhere, and isolated them. Not such a bad thing when we don't have a vaccine for this. Mm-hmm. We can't prevent it with a shot. And so, quarantine is still part of the entire treatment process, whether it's self-imposed or whether it's something that the government makes you do. I mentioned to Jane just before we got on, too, that the one place, actually two places that are the best, the gold standard, you might say, for treatment or prevention, you might say, too, of the disease, Singapore and Hong Kong. Because if they self-quarantine you, that's in Singapore, and they see you out on the street, you're going to have a fine and jail. They don't fool around. But they don't do that here in the United States. And unfortunately, there's already been a couple of cases where people were supposedly self-quarantined and they got out and reinfected somebody else, so it happens. It happens. So at any rate, why don't we talk a little bit now about what can people do? That's really what the bottom line is. What can you do to prevent it? First of all, we'll say you don't have the disease. How can you prevent it? Give me a few examples.
So the most important thing you can do is to wash your hands. And I know you're planning on showing us all how to wash your hands properly.
Well, I did it. For years I did it. I was a surgeon, and God, I scrubbed my hands till they almost bled sometimes, But yes, and that's going to be important, and I'll show you how to do it properly after.
If you don't have any soap and water, then you can use something like Purell. What you want to make sure is that it has at least 60% isopropyl alcohol. Do you want me to show them how to properly use this?
Sure. And, well, why don't we go ahead and squirt you? Woo! Sorry about that. It shows you.
So you want to have enough so that both your hands are really wet. And then you want to make sure that you do the backs and you scrub in between and make sure you get the area between your thumb and your forefinger. Then you want to do it on the other side. And then you want to keep rubbing this in until it's completely dry. And it's going to take at least 10 seconds. So you just keep rubbing in.
How does that work? How does alcohol sterilize your hands?
So it kills the virus.
It dehydrates it.
It's-
That's
yeah,
right.
yeah,
It
yeah.
dehydrates the virus. So you got to wait till it's dry before you go
It
and
works.
touch anything else. And you got to wait that little time, not a lot, but a little time. So that's the hand sanitizer, which you can't find now in the markets, because obviously with all the panic that the media has done now, it's all bought up. But I can tell you how to make the damn stuff. Only cost you a few cents. How's that? All you do is mix rubbing alcohol, get a jug of rubbing alcohol, get some aloe vera, and you can use one of your essential oils. And so, 2/3 cup of rubbing alcohol, 1/3 cup aloe vera, 8 to 10 drops of essential oil. I like lemon myself, but you can use lavender, use whatever. What smells good? You know, you want your hands to smell good. And so, that's it. You've got yourself a nice batch of the hand sanitizer. How about on surfaces?
Yep, you can use either one of the pre-made hand wipes or the Lysol spray. So if you use the spray, you want to cover the whole area that you want to disinfect. And again, you have to wait at least 10 minutes before you
And
use it.
Clorox also has that as well.
Yes.
And either one is fine.
And the Lysol wipes, you want to make sure that the surface that you're working on is getting wet. You want to wipe down the whole entire surface. And the most important thing is to know when to do this. And you want to make sure that you do it if you're going to be handling food or in areas that are high touch. So like faucets, your cell phone is another really important.
Cell phones and your tablets, oh, they are big on the
They're
list.
probably the most touched
They
that
are.
we have.
They
There
are.
are certain wipes, and I had bought these. It's called Nice and Clean to do your cell phones. It said it has isopropyl alcohol in it, but I don't know how much. It didn't say the percentage, so I'm not so sure. I saw this morning on one of the news shows they were saying if your tablet or your cell phone gets wet, it could ruin them. But I've been using this on my cell phone for years, and I've never had a problem.
No, good. So what we've talked about now, a couple of the ways that we can protect ourselves. Number one, hand washing or sanitary wipes. And how about a mask?
That's not recommended unless you're sick. And like you said, we want to save these for the healthcare professionals. The masks leak so that all the viruses can get in. And once you've worn it for half an hour, they say they're not
Not too well
good,
anyway.
yeah.
There are 4 different types of masks out there. Probably none of them you can buy now because they got all sold out because people are panicking. But the first type is only a 1-ply. Now you understand these plies because you've wiped yourself with enough toilet paper. You know a 1-ply is very, very thin. That's what they use for isolation. Then there's, they also may have a couple of 2-plies, but that's for isolation only. And the surgical mask, which are these are 3-ply. And on the inside, there's that shiny little membrane where you're breathing in because you don't want that moisture to wreck your mask in a half hour or so. You want to be able to have this at least for a couple of hours. But you need to remember it's got a nice little wire across the top that you can fit to your nose. But you got to fit it. So you put it on and press with the 2 fingers from the side. Now that'll help to seal it on the top. But depending on how tight you tie these things, you may get, in fact, you probably do get some leakage all the way around that mask. So these are good for a few hours, certainly better than nothing. And, but it's not recommended, like Jane said, not recommended unless you have the disease. Now, as far as the healthcare professionals go, what should they be wearing?
Well, they really recommend that the N95 respirators, which are very difficult to find.
Yeah.
And you have to be fit tested. They put like a little hood over your head and spray some nasty smelling spray in there. And if you can smell it, then you're not sealed. So if you have facial hair, it's impossible to fit test you.
Yeah. And then there's, that's the third type of mask. Then the fourth type is, it's N99, which means 99% of all of the particles will be trapped in there. Obviously, N95, 95% of the particles should be trapped in that mask as well. But they are not reusable, unfortunately. And so they're not cheap. I know I went online today, see if I could buy an N95. The cheapest I could find was $20, and it was out of stock. Out of stock. So what are you going to do? Okay. Well, anything else now? Should we shake hands?
No, they suggest the elbow bump.
Elbow bump. Elbow bump. And you know, even in the churches now,
yes.
They finally did say, nope, no more holy water. Nope, no more greeting. Nope. Elbow bump. Okay.
Other things that you can do is cover your nose and mouth if you're going to sneeze or cough with a tissue and dispose of them right away. They used to recommend coughing into your elbow, and that would be a second choice now. But really, they're recommending to.
That means you got to carry
tissue.
Around with you. You got to carry a bunch of Kleenex with you.
Right,
You know?
and not a reusable handkerchief that.
But remember now, if you cough into your clothing, that clothing now better get washed very quickly.
Yep.
Because now it's contaminated. Okay.
Right. So,
and when should you wash your hands?
Well, certainly before eating, if you're going to prepare any food, after you use the toilet, after you cough or sneeze, changing diapers, helping your children toilet. Anytime your hands are soiled, you really want to make sure that you're washing your hands with soap and water.
Good. Incidentally, on the soap, liquid soap, if you use a bar of soap, put it back onto the little container that holds the bar, and if you were contaminated, that bar is now contaminated. So anybody else who uses that bar, they're going to get contaminated too. And so liquid soap, and then you dry with a paper towel, not with a cloth, paper towel. That's another one of those real dirty areas with the cloths. And it's sort of like sponges in the sink, you know. Once you've used that for a meal, that sponge is contaminated most likely, especially you add chicken. You know, you got to be very careful about that. So, okay. You know, I also learned one thing too, reading the CDC. They also recommend that you don't wear your outside shoes inside the house. You should take your shoes off, just like they do in most countries. They take their shoes off, and they either walk in their stockings or they put their slippers on, you know, but they don't wear their outside shoes inside. I didn't even think of that, but that makes sense. Makes sense. How about wearing gloves?
Only for healthcare professionals that they recommend that. I mean, some people are wearing them when they're riding the subway. Probably don't work.
Probably don't. Probably don't. So you don't need to wear gloves all the time, unless you're caring for somebody who has the actual disease. And so, you know, then you probably should consider getting some gloves. And so anything that you touch that they've coughed into or breathed into, whatever, use your gloves. Don't touch it with your hands, and dispose of it right away. Right away. What about this thing about the food supply now? If you may have to get self-imposed with a quarantine, should you have 2 weeks worth of food at home?
Well, you're going to be quarantined for 2 weeks, and if you don't have anybody that's going to drop off food for you, that's what the recommendations are. I really think that's overkill. It is not in the community right now. We don't even have one person infected in the Worcester area, so that we know of anyway.
That we know of, yeah.
So I'm not recommending anybody
Good.
to go out and get 14
Good.
days worth of food.
I think probably one of the more difficult things too, if you feel sick, you should not go to work. Some of the worst ones, doctors and nurses are the worst people. They'll go in, they'll go in to work, contaminate God knows how many other people, you know. We're the worst. But if you're feeling sick, you stay home. You call it in.
Yep.
And so, okay. Very good. Now, tell me about the tests.
So the tests are not available right now for the general population. Some of the hospitals are now testing. Those tests go into the state lab, and the state lab tests them, and then it goes into the CDC, which takes probably 4 or 5 days. And
Yes,
if it's a
it does.
weekend, even longer.
But those tests were for the SARS virus, and what it does, SARS also was a coronavirus, and that had that single-strand DNA. That's what it tests for. We're not sure how reliable these tests are either. You know, so at any rate, the tests are probably, they're supposed to be in the mail. We're supposed to be able to get them, but I don't know. I don't know. So at any rate, that's basically what we wanted to get across to you here. These are what we know now. We could come in tomorrow and have a totally different presentation because things are changing all the time, unfortunately. Well, Jane, thank you for coming.
You're very welcome.
We
It's a
love
pleasure.
to have you here, give a perspective, because remember, I'm just a surgeon. What do I know about this stuff, right? Okay. Have a nice day, and prophylaxis. Take care of yourself.
Yes.
Okie doke.
Use your hand. raise your
Yeah,
hand.
that's the stuff. Okay, this is Dr. C. He's going to show you how to wash your hands. I'm an old surgeon, so I washed plenty of hands in the past. Liquid soap, not a bar. You contaminate your hands, you use your bar, put the bar back. That bar is contaminated. Next time you use it, you're going to recontaminate your hands anyway. So, liquid soap. We put a couple of dabs into the palm, just like that. And a little bit of water. We're going to spread that around, first on the inside of the hands. Then you're going to go in between the fingers, just like that. In between. Getting both. Once you do that, the top of the hand, all the way up to the wrist. You gotta go all the way up to the wrist. All the way up. And then you continue doing that again. Palms, in between, top, and then the wrist. Got it? 1, 2, and 3. And then, gonna dry it. I'm sorry, not dry yet. We did that for at least 20 seconds. You wanna do it for 30? Beautiful, do it. Now, you notice there's no towels in here. Why? Because you're gonna contaminate the towel as soon as you use it. This is what we use. Paper towels. Paper towels. Just like that. And we're not done yet. Once you dry your hands, you gotta get out of the bathroom. First of all, I never touch that again with my hands. And to get out of the bathroom, again, I don't touch with my hand. Doorknobs, knobs for the sink itself, very contaminated places. So you want to avoid recontaminating your hands. So now I'm good. If I have to push things, I'll push it with my elbow, and we're all set.